Well, smartphones and computers emerged as a virtual lifeline between people and their doctors as this pandemic unfolded, and even as restrictions ease, telehealth may continue to be the best way to handle routine doctor appointments. Dr. Brent Wallace of People's Health joins us via Google Duo to talk about the importance of staying in touch with your healthcare providers. Hello, doctor. How you doing this morning?
Pretty good. How about you?
Oh, not too bad. So what's happening right now with Google Duo is very similar to telemedicine, right? I guess explain to the folks who may, this may be new to them, what is telemedicine?
Sure. Yeah, and I think this is new to a lot of us, but telemedicine is essentially a two-way audio-video communication that a patient can have with their physician.
And so they're able to, kind of maybe show you some things. You can talk about some of the symptoms. Why is it so important, especially during this time?
Well, I think it's very important because a lot of physicians have lost communication with their patients, and likewise, patients haven't necessarily reached out to their doctors to talk about any of their health concerns. I think during the pandemic, we've been so hyper-focused on what's going on around us that we're not always thinking about what's going on with ourselves as well.
So some people may be, avoiding the doctor for one reason or another, maybe because they're scared to go into a hospital or a doctor's office right now, but they also may be avoiding the doctor because of costs. Telemedicine, in many cases, could be covered by your insurance.
Yeah, I think insurers and providers alike have worked together to break down those barriers to receiving care. So this is really a great opportunity, I think, to bring more technology into medicine and make doctors more available to the patients that they care for.
Some folks might say, hey, look, when I go to the doctor's office, you check my heart, you check my pulse, you might, feel, something in my throat or whatever it may be. Some of those things can still happen, especially when you can share pictures and things of that nature, right?
Yeah, definitely. I think it's, there are some constraints, certainly, that we can't do, things that we could do when we're in person with you. But, for example, a lot of people have scales in their house, so we can ask you to check your weight. You know what your height is, so we can calculate a body mass. A lot of people with chronic medical conditions may have a blood sugar meter, so they can tell you what their sugar is, and also a blood pressure meter, so they can tell you what their blood pressure is. So it's really amazing what information you can glean. I think another thing that's great is that a lot of physical exam is observation. And so if we can see you and communicate with you and ask you to do certain things, there's a lot of things we can diagnose or at least have a hint that a diagnosis may exist and tell you we need some additional testing.
And especially in, the age of the coronavirus as well, if that's something you're concerned about, I mean, you certainly don't want to, go into some sort of a medical facility and have the potential of spreading it to other folks. That gives you the opportunity to assess someone in a very real way.
Sure, and I think a lot of providers right now are using telehealth to do screening. So especially now that the stay at home order is being relaxed a little bit, more and more providers are coming online so that they can see people in their offices if they feel like they need to. But telehealth is actually still a great tool for them to be able to assess whether or not you need to be seen in person or if they can prescribe virtually for you.
Well, it sounds like something that will continue on for some time, even after the coronavirus. Dr. Brent Wallace, thank you so much for joining us this morning.
Yeah.